So my name is Stephanie Gandomi. I'm a genetic counselor, and we're going to talk a little bit about some tools for living with a chronic illness. So I want to thank Global Genes for allowing me to have this opportunity to speak with you today. And I also want to encourage caregivers who are here today to really consider these tools not only for their family member who is living with a chronic illness, but also for themselves as well, because it really pertains to both. And so just a little bit about my background. I'm a certified genetic counselor, and I worked for many years in clinical practice at Lucile Packard Children's Hospital at Stanford. I've also done some doctoral level training on somatic-based psychology, which talks a lot about the body and the psychology of the body, as well as MFT, marriage and family therapy training and trauma. I also have 3 children, so I can relate firsthand what it's like to juggle many things at once, and also have had firsthand experience with family members and friends who also have lived with chronic illness. And so some of what I'm going to be sharing with you today is a combination of both my training in genetic counseling, my personal experiences, as well as some of my own philosophies also. So the definition of chronic illness, according to the U.S. National Center for Health Statistics, is a disease that lasts more than 3 months. It cannot be prevented by a vaccine or drug. It cannot be cured by a medication, and it does not generally just disappear. And then rare diseases can also be chronic illnesses, and these are ones that we see less commonly in the definition right now as a disease that affects less than 200,000 people. So the CDC gives some interesting statistics about chronic illness. In 2012, about 50% of adults in the United States are living with a chronic illness, and about 7 out of 10 causes of death are actually attributed to chronic conditions. Obesity, arthritis, epilepsy, diabetes make it to the top of the list of some of the most common disorders that are considered chronic illnesses. And 88% of individuals of over the age of 65 are living with a chronic illness. We know that there are many different factors that come together that contribute to the onset of and sustainment, I guess, of chronic illness. Genetics plays a huge role. Sometimes we know what those genetics are, and sometimes we don't. Environmental components, maybe interacting with genetics, can also be responsible for chronic illness. Mental health, both as a result of the chronic illness as well as a contributing factor to the illness, is an issue. We see social factors, lifestyle factors also contributing to chronic illness. And we'll talk a little bit more about what these are and how to manage them. So take a moment and think of yourself. Think of things that make up who you are, because it's often very common to get lost in the diagnosis and in the hustle and bustle of all the multiple medical appointments that you have, and all of the diagnoses and the labels that have been placed on you or your loved one. And think of yourself in more of a positive light. So think of what you are versus what you're not, what you deserve, what you think you don't deserve, what you will do, and how can you change your own health and have your own power to make it better, even when living with a chronic illness. We're complex beings. We're not just our diagnoses. We're not just the body that we're in. We have sometimes pain. We live with a disease. We live with the symptoms of the disease. We have these physical experiences of this chronic illness, but we also have emotions, and we have a psyche, and these can be impacted both positively or negatively depending on the way you perceive your experiences. We have these psychosocial concerns. So all of these are interacting elements. They can impact one another. If you're in pain, it might impact your emotional well-being. That in turn could impact your finances, your employment, your ability to sustain your family. And all of this is interconnected. And so it's too difficult to piece them out individually, because you have to think of yourself as that complex being made up of all of these different factors. And so sometimes patients with chronic illness will report feeling a variety of different emotions, many of which are described as helpless, feeling hopeless, and this can be true for the caregivers as well, or extended family members. They may feel anger, sadness, frustration at the physicians or the lack of knowledge of what is causing the pain. Confusion. One day you're told you have one thing, another day you're told you have something different. Guilt and shame. Perhaps you have looked inwardly to try to understand, maybe I shouldn't have smoked, or maybe I shouldn't have done this or this when I was younger, and maybe that's contributing to it. Or even feeling at your core that you're deficient, and that might be a cause of what's coming, manifesting physically. And just sometimes fear of the unknown, fear of what could be coming next, and what may be for your family, and the family can also feel fear for the patient. In genetic counseling, we talk a lot about shame and guilt, both in the diagnosed population as well as the undiagnosed. And shame is this painful feeling of humiliation or distress that's caused by the consciousness of shortcoming, and it's often turned inward. So it's really coming from a core feeling that there's something deficient inside. Guilt could be a feeling of worry that you have done something wrong. And so we see this very commonly, both in patients themselves, in family members, extended relatives, friends. This guilt and shame, these are really strong areas of counseling that need to be dealt with if they haven't been dealt with already, because they can actually be very toxic to both the mind and the body. So what do we do about some of these complex emotions and feelings that we feel when we're living with chronic disorders? So number one is, I think a lot of times patients really struggle with the whole feeling and the cycle of grief. Even though we may still be alive or your relative may still be here with us today, grief doesn't mean that it's always about someone who's passed away. It could be the loss of life that you had, a loss of vitality, a loss of dreams and goals that you once shared with your partner. And so there are cycles of grief. And all of these cycles are experienced in different ways throughout different parts of your life. And each person grieves differently and about different things. So some of the cycle components of grief are denial, anger, depression, bargaining, acceptance. Those are the traditional ones. So perhaps you start manifesting symptoms of a condition, and and it doesn't necessarily have to be in this order either, but denial would be, I'm fine, I'm okay, I don't have anything wrong with me. Anger would be like, why is this happening to me? Why am I'm a good person, I don't deserve this. Depression obviously speaks for itself, often that feeling of just, I can't do this anymore, and life isn't necessarily worth living perhaps. Sometimes you even see suicidality in that stage. Bargaining, okay God, if you can, I promise I will be a better person if you can make these symptoms go away. And acceptance is often towards the end where you finally say, you know what, I guess my situation isn't going to change. I have to figure out how to do this differently. So historically, the grief cycle seemed to be this very neat and tidy cycle. But I think over the years, as researchers have looked more and more at the grief cycle, we've realized it's actually quite messy. And everybody does do it in their own way. Some people describe it as an emotional soup. Other people describe it as this vortex or this tunnel. And some families with complex genetic conditions will often say that there are way more stages than just the 5 or so that we traditionally think are involved. And so that's why I showed sort of the 5-step traditional model, and then the ones that sometimes, I thought this was a good illustration of what sometimes people say they're experiencing. But there is often light at the end of the tunnel. And I think the most important thing to think about is when grief does set in, whether it be about a dream or about your health, that you really realize that it's a process. And in order to make it from one end of that process to the next, you have to go through it, just like a dark, scary tunnel, because there will be light at the end of it, and you don't have to do it alone, and we'll talk about that too. So along with grieving and trying to work through the emotions of having an illness, it's important to live in the present as well. So you're still here, even if you're grieving, even if you're going through these difficult times. But finding balance is so important. Looking at your spirit, looking at your soul, remembering that you're living with your diagnosis, but your diagnosis is not your entire life. You do have other things going on in your life. So look at how you can focus on some of that. And that's also the case for caregivers. You're not just there for that person 100%. You need to have a life for yourself too, because your well-being will also help your family. So try to restore balance through the day. It's a practice. Just like physicians have to practice their trade and their profession, it's important that you practice balance on a daily basis and make it part of your routine. It's not just something that you do on the weekends or once a month. It's something that you do all the time. So another tool is asking for help. And I think that this can be something everybody struggles with. I know even when my babies were born, I used to think, I can do it all myself. But you can't. You have to ask for help sometimes. So when you start to feel yourself kind of going into that quicksand, or you're like, I can't breathe, this is becoming too much, those are signs. Think about your body. What tells you that you need to ask for help? It's okay. We have a culture in which asking for help sometimes is viewed as being a weakness or a failure, or you don't feel like you're a courageous person, but actually asking for help is courageous. And use the internet. For a long time when I first became a genetic counselor, it was always like, don't look at the internet. It's all, scary things. And there are a lot of, scary things on the internet. But at the same time, there's so much value. And studies have come out that have shown that families with chronic illness and parents with children who have rare diseases can often find each other on social media and the internet. But just be wise about it. Make sure that you're going to trusted sites, make sure you're sharing your stories with people that you trust, and that you don't become a victim of some misinformation. Contacting support organizations. Obviously, Global Genes is an excellent one to contact for rare disorders. There are many others as well for various conditions. They often have great resources and tools to provide you with help. Seek medical advice. If you have a trusted physician or nurse practitioner or someone else in your medical team, ask for help. And connect with social workers. Hospitals, major universities often have social work departments that can provide help, and it doesn't necessarily mean emotional, psychological. It could be financial. It could be transportation. It could be, I need some resources so I can get some respite. Those are all things that there are programs established to provide caregivers and patients with. And then obviously I'm a big believer in counseling and psychotherapy, so using resources to get connected with a psychologist or a family therapist or even a social worker to provide ongoing counseling for the depression, for the grief, can be really useful. But just don't ever be afraid to ask for help. So surround yourself with supportive people. There's nothing worse than having a bunch of toxic people in your life when you're already feeling down and depressed and lousy. So accept positive support. And I always do this in my own life. I'll sit there sometimes and I think, okay, who are the people who make me feel good? Those are the ones you want to keep in your life. Who are the people who are toxic, who make me feel yucky when I'm around them? Those are the people you don't need in your life. And it's okay, because it's healthy boundaries. It's putting that boundary on yourself and saying, right now, we're in a very stressful time of our life. I'm having to give a lot as a caregiver, or I'm giving a lot as the patient. I don't need any more toxicity in my life. And that's okay. You deserve to be able to put those boundaries down. So look for positive resources. That means find positive support in the community, in your disease community. Medical communities often have excellent positive support groups, resources you can go to, people who truly understand what you're living with. Sometimes there are excellent groups in the community. Maybe your disease is so rare that your community doesn't have a group specifically for that disease, but that's okay. There may be another group that you can kind of tag onto and they'll accept you. And look for those resources. Sometimes religious communities can be very helpful. Even your own neighborhood. Maybe they make meals or help with cleaning your house. And also within your own social network, friends and extended family members, and hopefully your immediate family is helpful as well. But sometimes there's toxic people in the immediate family too, and so maybe putting the boundaries around that is not a bad thing either. And so another tool is laugh. The healing power of laughter is so amazing. So laugh often. And as our friend down here, the Peg, says, every time you're able to find some humor in a difficult situation, you win. And so actually, laughter is known to promote positive biochemical reactions in the body that improve your immune system, improve your health. It can enhance your relationships, and it impacts others positively. So maybe you're unable to perform physical activities like you once were, but laughter is something that you can provide to the outside world, and it's a way to contribute in a different way. And so it just is something that we often forget to do. It's very simple. And so again, find people in your positive support group or your positive neighboring, groups that you have, and find some time to laugh with them. Find someone special. It's really important. So it also helps separate you from just living the diagnosis. So then, tool number 6 I'm throwing out there is just nurture a healthy lifestyle. I think this is incredibly important, especially for the LEMS community. There's obviously increased risks for cancer and for other conditions and comorbidities. And so you might as well give yourself the best physical boost that you can. That means reducing smoking, obviously abstain from drugs, increase your nutrition, watch your diet. Make sure it's healthy, full of fiber, nutrients, minerals. Water is so important for the body. Exercise regularly. Make time for healthy fun. And that may be games with your relatives, your family, laughing, watching your favorite TV show, going to a movie. Eliminate as many risk factors as possible. So if you have limitations, don't put yourself at risk. You already have enough to deal with. You don't need to add anything more to your plate. So I won't get too much into this because I think Lisa's going to talk more about it, but be your own best advocate. I think a lot of times it's very simple to hand over our autonomy and our decision making to our providers, and for the most part they're excellent and they have your best interest at mind. But I think you always should be your own best advocate no matter what. And I think having worked in the pediatrics realm for many years, I've really come to appreciate parents and how much they advocate for their own children. So they ask plenty of questions. Don't be afraid to ask them. Keep copies of your own records so you know what tests have been performed, what the results of those tests have been. Know what's being done to you. If you're being given a treatment, it's okay to say, what is this? Can you explain this to me? What am I going to expect to have happen to my own body? Request opinions, second or third opinions. I'm sure many of you have already done that because on the quest to a diagnosis, it's often led you to that naturally. But even if your gut says this just doesn't feel right, I don't think this is what I have, then by all means you have the right to ask for a second or third opinion. Speak your mind, obviously kindly and with graciousness, but say to your physician, I just don't feel like I'm feeling good, or that medication you gave me isn't settling. Can we try something different? It's supposed to be a partnership, and that's okay. Share your feelings, your symptoms, your experiences. Grow a mutual respect with your healthcare providers. It's a team approach, so the more you respect them, the more they'll respect you back, hopefully. And that's the optimal way to have healthcare. Read, educate, and inform yourself with accurate information. So again, you can feel free to browse the internet, ask people questions. Just make sure that you know what it is that you're getting and that you're armed with accurate, correct data. Always assess your own comfort levels. I think that it's important if something is being performed to you that you feel comfortable with that, and if your pain threshold is, I remember even just having my own children, there were certain procedures where it was like, I'm in pain, stop. And if they say, no, we're gonna keep going, it's like, no, this is my body. We need to have an alternative to this. And you have the right to say that. Everything's not gonna be easy. There will be pain through the process. But I think it's that communication and being able to say, I cannot handle more than this right now. And don't be afraid to ask for information. Again, ask for help, ask for information, empower yourself. So I'll quickly talk about locus of control. Some of this is culturally derived. So if you've come from a different ancestry, or perhaps you were raised in a different country, Sometimes what we call your locus of control may be external or internal. It's got a lot of, there's a lot of cultural things that contribute to the way you look at that. But your locus of control is asking whether things that impact your life come from the outside or whether they come from inside. So an internal one is, I have control over my own health care, I make my own decisions, I'm in charge of my own future. An external one may be that, well, that happened to me because I did something, even sometimes people will say in a past life, or God felt that that was something I needed to have happened to me. And so it's okay, they're all normal, and there's not right or wrong way to have a locus of control. It's important to understand what your locus of control is. And so how does something impact your life? Does it come from the outside in? Does it come from the inside out? And just understanding that will also help you understand yourself, and it'll help you to understand how to empower yourself. And so if you are struggling with it and you feel that often you're a victim in a lot of your own circumstances, you may have an external locus of control. There needs to be a balance, because if you have just an internal locus of control, it means that you feel like you're in control of everything, which isn't always the case, right? Your symptoms, you can't control those. So if you're finding that you're kind of too much on the one or too much on the other, it's important to kind of work with maybe a therapist or counselor who can help you balance that a little bit, because obviously your cultural beliefs and your own beliefs as a person about religion or spirituality come into factor, and that's okay, and that's part of you. But it's also important to feel empowered from the inside, because you do have actually quite a bit more power than you realize. So it's just finding that balance can be really important, especially when navigating the medical system. I think priorities are something we often lose when we become very internally focused, which happens a lot of times when you're stressed or you're ill. There's I should have probably made a slide about it, but there's a hierarchy of needs. So Maslow's hierarchy of needs, where you basically are at the bottom of the needs are things like safety and food and shelter. As you go up, it's more like self-actualization, spirituality. And so he says humans go up and down based on things that are going on in their life, feelings. So if you're sick, if you're ill, you tend to probably function on the bottom because you're getting through the day and you're trying to make it. Whereas if you're healthy and vibrant, you might be moving up that triangle. So often when you're functioning more on the bottom because you're just trying to get through the day and living with the pain, it's important to really say, okay, what is essential? What do I have to do today to get through the day? And happiness actually and things that are important to you are important to put in that daily checklist, because you need to know what is going to give you the vibrancy that you need, the life that you need to get through even some of the most dark days where you're really struggling. And so take some time to think about this. What makes me happy? And are you doing that? Are you doing it every day, or do you put that to the side because you have other things that you're doing or you feel are more important? Are you spending enough time with your families and friends? Are you valuing your relationships? Are you creating goals for yourself, or have you lost that in the process of obtaining a diagnosis? Sometimes we get so wrapped up in the diagnostic process that we forget we have other parts of our life that need to be nourished as well. And by nourishing those priorities, you're actually nourishing yourself. And seek counseling. I can't say that enough. If you need counseling, if you need help, there's so many great counselors that can really change both yourself, the way you look at your priorities and your daily life, as well as your relationships, your marriage, and in your relationships with your children as well. And so finally, always have hope. Everything is changing so quickly. We saw that today in some of the lectures we've had this afternoon, that no matter what is out there right now, this can change next year. It can change in 3 years. And so maybe a cure is right around the corner and we don't know that yet. But if we lose hope, then we're going to lose that window of being able to receive it when it does become available. And it may not happen in your lifetime, but it may be available for the next generation. But unless we keep up hope as a community or keep up hope individually, then we're not going to have the ability to pull everything we can together so that we can move this forward and find answers for rare in chronic illnesses. So, think about all of the good things that are happening every day. And progress doesn't happen overnight, but I've been in the field now for many years, and where it was 12 years ago and what it is today, I would never in a million years have dreamt that it would look like this today. So in the next 10, 12 years, we can't even begin to fathom what's coming. So always have that hope, and that also benefits your family members. If you're hopeful, they're going to mirror that hopefulness as well, and it gives them courage and it gives them support also. So a couple last things before we conclude. I wanted to talk a little bit about mindfulness. So mindfulness is actually it's a mental state, but it's a practice that you often see in more modern psychology. And but it's based on more Buddhist teachings and ancient counseling methodologies. And they found that mindfulness practices have such an incredible impact on patients. So the University of Massachusetts Center, so the UMass Medical Centers actually implemented mindfulness in medicine, healthcare, and society into their medical system. So they actually have courses at the hospital that teach patients about mindfulness, and it has shown to improve life, not only life quality, but even the health care of patients with chronic conditions like cancer, sometimes even terminal conditions. So that's a website you can go to, read more about it. They have, there are a ton of courses online that you can take. There are some books, CDs, things that you can do in your own living room. You can even YouTube or Google mindfulness, and it comes up all over the internet. But I think mindfulness is just a way to stay in the present moment, is really what it's about. So when you're living with chronic disease, as we were talking about, you're always thinking about the future or grieving the dreams that you once had. But if you're able to bring yourself back to the present and just say, let me just deal with what's on my plate today. Not worry about 3 years from now, not worry about 20 years from now, not even worry about tomorrow. Just bring myself back. And that really helps reduce anxiety and stress. And so obviously there are tons of great resources. These are just a few. It's only the tip of the iceberg. But Global Genes has great toolkits, as we've talked about in webinars. You can find some excellent chronic disease and patient websites online right now with just great toolkits and resources and fact sheets that you can use. So these are just a few that you can go to. I just kind of took a look to see what I could find, and there are, quite a number of emotional resources. Focus on the Family is actually a great website for individuals who have a Christian-based lifestyle in their home, and so there are a lot of resources for interacting with your spouse, your children, other people in your family while living with chronic disease and pain. The APA has a whole segment on coping with chronic disease, as well as resources for referrals. And there are these great service dogs that are available for patients who have emotional needs. I always thought of service dogs primarily as being for the blind or for even epilepsy, but you can actually find them for emotional support. I think animals in general have a healing effect, so it's probably where it's coming from. And then there's more medical resources. Cleveland Clinic had a great website. You can look at your local hospital. They often have segments, whole sections dedicated to chronic disease. Social work departments often have flyers available. There was a website called Healing Well that had just a ton of things about chronic illness. American Academy of Family Physicians, and then nsgc.org is our organization I always give a plug to, that has information for individuals looking for either referrals for genetic counselors or somebody who can help on the genetics level. So there are a lot of resources and tools there as well for genetics. So finally, I'm just going to kind of wrap up with what are called positive affirmations. So these are so easy. They don't cost anything. You don't have to go anywhere to do them. You can do them in your home. But just, maybe pick a couple. Pick one and say it to yourself every day. I can live life even with my disease. I deserve support and concern from others. Sometimes we can feel like we don't deserve that, and that's that guilt and shame. But tell yourself over and over again, you're actually rewiring your brain. The more positive thoughts and feelings that you're experiencing. You know, I have hope, I have courage, I can do this. I'm not going to let this defeat me. You can take any one of these and make this your mantra every day. Every morning when you get up, you say it over and over again. Or you could make your own, anything that you feel. Think about what you struggle with the most, and turn it around. Turn it into something positive, and then just say that over and over again. So maybe you say, maybe you feel a lot of pain in your body every day, or maybe you're grieving the loss of being able to run. But I can still walk. I can still see. I can still feel my life. I can feel my children. I can see them. Think of the positive. So turn every negative thought into a positive, and then it will become, just keep practicing it over and over again, and it will become part of your life. And that has so many powerful effects in the body. And so I thought this was an excellent quote, kind of along those lines, but I can be changed by what happens to me, but I refuse to be reduced by it. And so even if you feel some days like you've just hit rock bottom and there's nothing left to give, there is always something more inside of you. And even if it requires asking for help or getting some more support, but don't let your disease reduce you. It may change you. It may give you a different life than you expected, but you have a lot more inside than you realize. And sometimes you just need that little extra help, and this goes for caregivers as well. So don't be afraid to ask for that help, and don't be afraid to turn for resources. So, and that's it.
Thank you.